Hi, I'm Vera.
I'm Nimit.
And this is Epi News. We are live here in Houston at School of Public Health where this shocking home video has surfaced. The video, which was filmed by a dad, shows a happy UTHealth student, David Sanchez, before he goes into a big soccer game.
A couple of minutes into the game, he drops dead all of a sudden, causing panic and mayhem in the field. Here's the raw home footage. Viewer discretion is advised. Our reporter Charles went to the UD San Antonio campus to interview students and see if they know anything about sudden cardiac death. Take it away, Charles.
Have you heard of sudden cardiac death?
No.
Do you know anything about it?
No.
Do you know what an AED is? Like a defibrillator or something?
Yes.
When do they use those?
A defibrillator? When someone's when someone's heart stops.
Nice. Do you know, have you heard of like sudden cardiac death screening or anything like that?
No.
Never?
Uh-uh.
When you were in sports, when you were young, did you ever have to go through a physical where they asked you about your heart?
Yes.
What kind of questions did they ask you?
I don't remember.
Have you ever heard of sudden cardiac death? You aware of it? No? Do you know of anyone who's ever, experienced young age, done sports, and experienced any signs of instant heart attack?
Yeah, I did have a friend who died from an enlarged heart in high school.
What happened because of that? Did they start any screening programs after that, or did they do it beforehand?
I don't know if they started I know it's because of this. We all did get screened afterwards. I don't know if they continued to do so since.
Okay. So, I was just talking to your friend, and he mentioned that there's a free screening service in San Antonio for sudden cardiac death.
Yeah, they set up a foundation for it. Now they offer free screenings for any athletes that want to pursue that.
Great. And do you think, like, before this would have happened, you would have ever known of anything like that, or
Not at all.
been aware at all?
No.
Okay.
The American Heart Association's 2017 report defines sudden cardiac death as an unexpected death without an obvious non-cardiac cause, which occurs within 1 hour of symptom onset or within 24 hours of last being observed in normal health. This has received more public attention due to the deaths of healthy college athletes that had no symptoms before they experienced sudden cardiac death during physical activity. In the general population, some risk factors that have been associated with sudden cardiac death are being Black American, male, and of low socioeconomic status. However, studies have not assessed risk factors exclusively in young adults. A 2017 study found the incidence of sudden cardiac death in young athletes younger than 35 to be 1 to 3 deaths per 100,000 persons. And when comparing athletes to non-athletes, they found that athletes were at a 2 to 3-fold increased risk of sudden cardiac death. The majority of sudden cardiac death cases are a result from genetic abnormalities of the cardiovascular system. Hypertrophic cardiomyopathy is a genetic structural abnormality in which the heart muscle becomes abnormally thick. It accounts for 1/3 of sudden cardiac deaths in individuals younger than 40. Other causes associated with sudden cardiac death in young individuals include electrical abnormalities, myocarditis from viral infections, and non-rhythmic reasons. However, these causes for sudden cardiac death are rare. It is ideal to screen young athletes for prevention of sudden cardiac death before participation in any sports. A 26-year nationwide sudden cardiac death screening program for athletes in Italy that incorporated family and personal history, physical examination, and a 12-lead ECG into their program saw significant decreases in mortality rates for the athletes screened, as well as a large reduction in annual incidence of sudden cardiac death in athletes. The table displays the differences in the incidence rates of sudden cardiac death between the athletes screened and the non-athletes that were not screened during the screening program time period. The use of ECG to identify athletes with cardiovascular disease at an early stage can prevent sudden cardiac death if activity in competitive sports is restricted and drugs to treat the cardiovascular disease are provided. A fundamental of screening is for it to be cost-effective. A 2010 study estimated that ECG testing added to a cardiac-focused questionnaire and physical examination would cost $89 per athlete screened and would save 2.1 life years per 1,000 athletes. The results showed that including ECG testing led to $76 per life year saved when compared to no screening. Research on sudden cardiac death screening on young athletes suggests the use of two main components. The first is a 14-element cardiovascular screening checklist recommended by the American College of Cardiology, which focuses on personal and family history of cardiac conditions and a physical examination to screen for congenital and heart diseases. The second is to use a resting electrocardiogram to detect any silent or congenital cardiac conditions. For our suggested screening program, high school athletes from a selected community would be required by their school to undergo the personal history, family history, physical examination, and the ECG screening before participating in school sports. If there are no negative findings in any of these tests, then the athlete would be eligible to participate in sports. If any positive findings found, the cardiologist might recommend an echocardiogram, stress test, or genetic test to help diagnose sudden cardiac death. The sudden cardiac death diagnosis will be done by the cardiologist, who will also provide referral for treatment if needed.